What's going on? Who are you?
I'm Captain Power Clean. It's time to bring a little excitement to your brushing routine. Follow me. So, kiddo, let's start with the basics. Why do you think you have teeth?
I guess it would be hard to eat a crunchy apple or any healthy foods without teeth.
You're absolutely right. Your teeth allow you to eat healthy meals every day.
Wow, with the way I eat, my teeth are doing a lot of work. Are the teeth I have now the same ones I'll have when I'm older?
Well, right now your baby teeth may be starting to loosen and fall out, but your permanent teeth will come in. You're right that your teeth do a lot of work, and it's important to take care of both baby and permanent teeth.
My permanent teeth must be pretty strong if they're going to last.
They sure are, kiddo. Your teeth have outer layers and inner layers. There's also a root that lives in your gums.
What are gums?
Oh, gums are the soft pink skin around your teeth.
I guess it's important that I take care of my teeth and gums.
It sure is.
Aloha parents, family, and children of Head Start. My name is Bryson Gonzalez.
And my name is Larissa Tawata.
We are both senior nursing students at University of Hawaii at Hilo, and we're leading a collaborative health project with the organization Parents and Children Together, also known as PACT, focusing on the Head Start program.
Together, we have created a video to educate you on the importance of proper dental hygiene and the effects of improper dental hygiene for your child.
But first, let's go over simple questions and answers about tooth loss. First question is, what do you think is a leading cause of tooth loss for an adult? Is it A, contact sports, B, aging, C, gum disease, or D, chewing hard candy?
The answer is C, gum disease. By preventing gum disease, you should be able to keep your teeth throughout your life. The common signs and symptoms of gum disease are bad breath that won't go away, red or swollen gums, tender or bleeding gums, or pain while chewing. So if you're experiencing any of these symptoms, it could be a sign to go and visit your dentist.
This brings us to our next question. What is the best way to prevent gum disease? Is it A, chewing sugar-free gum, B, physical activity, C, more sleep, or D, good oral hygiene?
The answer is D, good oral hygiene. You can keep your teeth and gums healthy with proper dental hygiene.
So there we have it. Good oral hygiene can prevent gum disease, which will ultimately prevent tooth loss. So if you're already using good oral hygiene habits, keep up the good work. If not, why not start now?
According to the American Academy of Pediatric Dentistry, tooth decay is the single most common chronic childhood disease and is 5 times more common than asthma. An estimated 5% of children under 6 years old, which is roughly 300,000 U.S. children, experience significant levels of early childhood caries. Children between the ages of 2 and 5 who have not visited a dentist within the past 12 months are more likely to develop caries in their primary teeth. In addition, low-income families suffer twice as much oral disease and are more likely to become untreated.
Oral health is important because when it's not cared for properly, it can affect a child in various aspects in their life. Improper dental hygiene can hinder a child's speech, communication, eating, sleeping, quality of life, and learning. This may lead into adulthood, impeding their success in the future.
We hope we got your attention, but if we haven't, here are some reasons why this applies to you. Children in Hawaii rank near the highest in the nation when it comes to tooth decay. The national average is 5%, while Hawaii's average is 13%. That is almost 3 times more than the national average.
As you know, all Head Start children are required to complete 8 different screenings, which includes hearing, vision, dental, lead, hemoglobin, blood pressure, physical, and immunizations. All Head Start children need to be current with each of these 8 categories within the last year. After reviewing the 2014 health screening records for Big Island, results show that dental hygiene is the #1 problem that Head Start children face. According to the results, 70% of children were current with dental exams, while 11% were expired, 10% within the 90 days, and 9% past due. Hopefully, these results help you see that there is a decline in care with proper dental hygiene.
It is very important to take care of baby teeth. Teeth are important because they help your child eat, speak, and smile. Around age 3, children have all their teeth. These are called primary or baby teeth. Next, around age 6, these teeth begin to fall out, which leads to the permanent or adult teeth, and most permanent teeth come in by age 13. If baby teeth are not properly cared for, it can cause a child to be in pain, the teeth may have to be removed, or there may be large gaps or spaces which can affect the development of their permanent teeth.
When teeth and gums are not properly cared for, it can lead to cavities. Common ways that cavities form are tooth decay germs that are passed to the child, your child eating sugary, starchy, or sticky foods that feeds the germs, helping them grow and multiply, and improper teeth cleaning. Also, studies have shown that it is very important for parents to care for their own teeth first, because that sets a great example for their children to follow.
We are here with Dr. Amin Kao, who will provide us with great insight on dental hygiene.
Aloha, I'm Dr. Kao. I'm a pediatric dentist here in Hilo.
Dr. Kaul, germs plus carbohydrates equals acid. What does that mean?
Okay, so germs and carbohydrates, the carbohydrates, as they get broken down, they turn into simple sugars. And germs or the bacteria in there, they use the simple sugars as food and also building blocks for plaque. So as they eat the sugars, they produce an acid. And then the acid that's produced from the bacteria sit on your teeth and they cause your teeth to dissolve or to break down.
And what is a 20-minute acid attack?
So 20-minute acid attack is once the bacteria produce the acid and it comes out and it's on the teeth, the acid will sit on those teeth and attack the teeth for about 20 minutes before it's washed away.
Looking at this picture of a child's teeth, there are arrows pointing at white spots. What are white spots?
So white spots are the beginning of cavities. So they're the start of a cavity. So when the acid is on the tooth and it starts dissolving the tooth, it starts breaking off the minerals, calcium and phosphates, and that weakens the enamel of the tooth. And as it weakens it, it turns white, like a whitish color. Okay. And then so when we say white spot lesion, that's when we know that, okay, that tooth is going to have a cavity pretty soon unless some fluoride is put in there.
Okay, so it just turns white, so it looks like white spots on your teeth?
Yeah, so if you look at a normal tooth, it's more of a glossy, shinier color. That's healthy. The white spot is more like a chalky white. So if you got like a piece of white chalk and you kind of color it over the tooth, it's a really brighter, chalkier white color.
Okay, perfect. And what are caries?
Caries is the same thing as cavities or tooth decay. It's just a different way people say tooth decay, or we say in Hawaii, puka.
Okay.
So, Dr. Kaul, in this picture, could you explain what's going on?
So in this picture, as we see on the tooth, there's a couple of things we see. There's white spots and cavities. On a clean tooth, there's a progression. The white spot eventually turns brown. So as it starts decaying under there and gets softer, it turns darker. So it goes from white, gets browner, browner, then dark. And dark means that the inside tooth is soft. Okay, and then as you see on the picture, as it's bigger, it starts to break apart. And then you have a big brown puka or a big hole, and then that's the cavity.
Now, what's going on in this picture?
Okay, so in this picture, as we can see the teeth, it's a different view from the last one in that these cavities are in between the teeth. And so the first view that we had earlier, the cavities are in the front, and that just shows that brushing wasn't done or they're getting a lot of soda or juice in the front area. This picture is good because in between you notice that that's where the cavities are. Your toothbrush kind of get in between. And so those areas where they're contacting, the only way to clean that is with the floss. And so this picture shows that this child hasn't been flossing, or the parents haven't helped them floss, and this is what happens. You slowly get the same thing. The white spot lesion forms in between first, and then it turns dark and soft, and then you get a cavity. And then what this picture depicts is that flossing hasn't been done.
Wow, this looks pretty painful. What's going on here?
Okay, so in this picture, as we can see, the two front teeth, the one on the left, if you're looking at on your right, there's a little bubble above it, like a pimple. That is what we call an abscess. Other words are for like perilous or a draining tract. This is a result. As you can see, the tooth looks shorter. So in this case, the tooth might have been knocked, and then the tooth broke. And when you have a break in the tooth like that, the nerve inside is exposed to all the bacteria. And so as the bacteria sits there and gets into the nerve, it works its way up into the bone. And eventually the nerve will die. And so as it dies, it gets necrotic, so it gets rotten, it gets all dissolved in there. But then the bacteria continue to fester, and as it festers, it focuses right above the root of the tooth. And then as it festers, it gets bigger and bigger, and it pushes its way out to the front, so towards the bone. And this is the result, is you get this nice little pimple-looking thing that comes out, and that's just all the bacteria that's been building up in there. And that is what you get. Exactly the same thing happens if you have a big cavity in the tooth. Okay, so the bacteria works its way into the tooth, up into the nerve and into the bone area, and then it spreads out towards the bone and the skin tissue, and then it breaks through, forming this abscess.
So what causes boy's face to get swollen and red?
A result of abscess that forms and is untreated, so like that picture we saw before, we had the pimple above it, or that big abscess, and if it stays there for a long time, what can happen is that the infection will continue to spread, and it will actually spread up into the facial tissue, so they call that facial cellulitis, where the infection is basically coming into the fascia of the cheeks, into the face area. If it's left for a long time untreated, it can spread throughout the face. Yeah, and so in the picture you can see it's coming up over here, the eye gets puffy. In the most extreme cases, it can get to the area of the brain. It's very rare, but this is a result that could happen. And a lot of kids, they do go to the emergency room for things like this. So it gets really tight, they can't breathe, they're having a hard time swallowing. And so the only way to reduce this is, one, antibiotics to reduce the swelling. If it's too severe and the face is really swollen, the infection, then your child will have to be admitted to the hospital. And that's IV antibiotics, and it's overnight stay. So you really want to prevent these things from occurring to your child. Another thing is the tooth has to be removed. Okay, so once that infection is in there, for it to actually go away, you have to remove the source, which is the tooth that has gotten a large decay in it.
Thank you so much for taking time to speak with us, Dr. Kao. What are some tips you'd like to give these parents and children?
Like we tell all parents and children is that the first thing is, once your child's teeth are coming out, you want to see the dentist when they first come out or before they're 1. Yeah, just so that we can get to know them and catch anything early. The next thing is, once those teeth come out, you want to make sure that you're brushing them. If they can spit well, use a fluoride toothpaste, but brushing it twice a day, morning and night. And the next thing is that when the teeth come on and they're touching, you want to make sure that you're flossing. That's a big thing. Is that daily. So just at night before they go to bed or before they brush teeth, just get that floss in there and get those areas where they're contacting. The next thing would be diet, right? So how they're eating. So you want to avoid the sticky candies. Definitely no soda. You want to avoid juice and really sugary things. After that, it's basically coming to the dentist. You want to be coming to the dentist every 6 months. That way we can catch things early and prevent getting cavities, or prevent having to do fillings, or in the extreme case, prevent having an abscess or infection. And so that's kind of what we like to tell parents, is to do those things at home, because we can do a lot here in the office, but once you go home, it's all up to you. So we do our best here, and then when you go home, part of taking care of the teeth is giving a good fluoride supplement. From your pediatrician or your dentist, they can prescribe a certain amount that would be perfect for your kids' teeth, to keep those teeth nice and strong.
Just remember, dental problems are less likely to occur if proper dental hygiene is used. and if dental exams are done every 6 months, because tooth decay can be caught at early stages.
It's important to take preventative measures to decrease the risk for dental disease at every age. Their baby teeth are just as important as their permanent teeth because if their baby teeth decay, then the risk for their permanent teeth decaying increases as well.
In addition, good oral hygiene provides many benefits that can go beyond cavity prevention. It helps keep your whole body healthy and fit. It can help you do your best at school and in sports, making your child feel better both physically and mentally. It even has cosmetic benefits including a nicer smile, fresh breath, and social confidence.
We hope this video reminds you that taking care of your smile should be an important part of your daily life, because a healthy smile leads to a brighter future.
Thank you.
Bye.